When we think of family roles, we think of how they impact the outcomes with addiction treatment. And every single family that has a substance user or a loved one with mental health issues will go in and out of and cycle through specific family roles. And this is not a family first interventionism or a Mike Lavertyism or an opinion of our organization. These are clinically backed facts. Every single family will go through them. It's something called family systems theory. And we know that every role will show up, and people will sometimes take on multiple roles. Sometimes they will cycle through them. And if I were to ask a room full of people who the problem was, they would inevitably say it's the person with substance use or mental health disorders. And they wouldn't be entirely wrong, but where they would not be seeing the big picture is that it is the enabler that starts the dysfunction. Because what ends up happening is the enabler, first of all, and this is textbook, their job is to react to the chaos and drama, and the primary role of the person with substance use and mental health is to create chaos and drama. So when the enabler starts that reaction, everybody else in the family system suffers. The husband suffers or the wife suffers, depending on who's doing it. The children suffer, friends suffer, grandparents suffer. There's a ripple effect, just like there's a ripple effect from the substance use and the mental health disorder. And what families fail to understand is that their drug of choice is the family role that they adopt. So the enabler, for example, their drug of choice is in fact the substance user, keeping them alive, or the belief that they're the ones keeping them alive, feeling needed in the relationship, having a purpose, validating themselves. They're getting something out of it. Just like the martyr who takes on the victim role gets something out of always being asked, what's wrong? How can I help you? And they're more concerned about what's going to happen to them if their loved one goes to treatment rather than what's going to happen to them if they don't. And then, of course, you've got the most destructive role, which is the hero, and their drug of choice is called perfectionism. They always do the opposite of what the substance user is doing, and they go into what we would say, hyper mode of being perfect in every way, having to be the one who fixes everything. All solutions have to be run by them. And what they ultimately do in the end is they sabotage just about any effort of getting that person well, due to the fear that if the substance user or person with mental health gets better, they may steal the spotlight away from the person who's worked so hard to be the shining star. Now, I can go into the other roles, such as the lost child, the scapegoat, the mascot, and we could get into detail, but they're not as destructive as the ones that I just described. But keep in mind when I say destructive, nobody does this with ill will intentions. And there are people that watch my videos and they get on our conference calls and they just get downright mad when we bring up these families' roles. Well, of course, we already know that anger is fear, and they just don't want to accept that those are their motives or those are those roles. But the substance user is another role in the family system. And that substance user can try to become a perfectionist themselves to make it look like they're doing better than they are. They can become a lost child and isolate to see how far somebody's going to go to save them. And that is when they go into that role is when interventions are most effective. And I know everyone's thinking, well, we'll call you now when we know they're in that role. And they're always in that role. They want to be saved. And my point is that the substance user and the family systems and the family roles are all intertwined, and they're all working against the solution, and they're all preventing the person from wanting help, asking for help, seeing the need for help, or feeling the bottom. So when a family system has been hijacked by a manipulative, dysfunctional leader, such as somebody abusing substances or afflicted with mental illness, they're being led by somebody who is not necessarily the best tour guide, if you will. And then families often are stuck with, well, how do we get out of this? We're not the problem, they are, which again isn't wrong, but how you react to it and what family roles you've taken on to compensate is preventing things from improving. So family roles play a significant part in the outcomes of addiction and mental health treatment. and they play a huge part in whether or not families take action. You know, one of our biggest challenges isn't getting people to accept help at the intervention. It's families agreeing to the intervention, and then after the intervention, following through with our recovery coaching program, because those family roles want to keep rearing their ugly heads, not only in setting this up, but fighting for that role to live on another day in our family recovery coaching. And when you break it down, it is almost identical to a substance user fighting to stay sick and clinging to their role of being the addict, the alcoholic, or the person with mental health. So guys, this all ties together. It is a family problem. We can't get one better without the other. And if we are able to do that for a short time, it is inevitable that it'll go right back to the way it was unless everybody joins recovery and gets better simultaneously.